Eric, the tables have turned again. The universe is in harmony. Now I'm back interviewing you. What did you take away from today, day one of the OECD/Spanish Ministry of Health conference on responsible scaling of AI in healthcare?
I think we've heard very clearly that there is still a lot of work to do to collaborate together, to find the signal in the noise, to actually make sure that we are using our data for good and to measure the use of the data that we have, because frankly, we're not using it as efficiently, as effectively as we could. And the third thing I would say is really that we have to focus on the regulatory environment. We have to simplify it, but we also have to make sure it delivers the needs of the public and of providers on a go-forward basis. Because ultimately, if we don't make sure that the public and providers trust what is being done with AI, then all the technology in the world isn't going to matter. We need to ground our work with AI in trust and effectiveness and safety and really humility in a way to make sure that we are achieving the best outcomes for everyone and everywhere.
What caught my attention was the session that we had around youth and AI and how youth is often referred to as the future workforce, and that's it.
The DTH-Lab, which is a global consortium, we are a research organization at the intersection of research, governance, and policy. And with that said, all of our work that we do, at the core of it is the health and well-being of the young children and adolescents. And we involve young people in all parts of the work we do. When we started looking at the analysis of digital national strategies maybe 10 years ago, we noticed that youth health and well-being was largely omitted from those national digital health strategies. When we now looking at AI governance policies and frameworks, we notice the same issues, the same gaps in the policies where youth concerns, health concerns and well-being are not addressed.
Young people are only referred to in different strategies and documents as only as the future workforce, and not really for what is happening currently to them in terms of how AI systems are shaping their lives.
In many countries, especially lower middle income countries, you have countries that have 50-60% of the population under 35 years old. How do you build a digital health strategy or an AI framework or policies disregarding the needs of 50-60% of your population?
One last thing that I'm going to share is the insight that the executive director of the European Patient Forum shared, which is around how 1,000 people that responded to a survey that they did experience AI.
The main findings include patients tend to be very positive about the potential of AI in healthcare, to the point that nearly 98% of them responded positively about AI. Of course, they also have some concerns, mostly because they are afraid of potential biases that AI can lead to. One of the takeaways was also the importance of patient information. Patients would like to receive a direct communication from healthcare professionals, and also they would like to receive, if possible, AI-specific consent forms. Patient information is key to support the trustworthiness of AI from a patient perspective, so that's an element that should be taken into account without scaring patients. So we need to strike the right balance in terms of which level of communication should be shared with patients and how detailed it should be. But it's important that to bring transparency. Last but not least, also a takeaway was that still patients see healthcare professionals as the key point of reference when it comes to the management of their health condition. And so they would still refer to healthcare professionals as the key point of contact and of information, where AI can be a tool to complement the information they can receive from healthcare professionals.
Eric,
Tasha?
that's it for today. Thank you for contributing to this special episode live from Madrid. Any last comments, last messages?
Simply put, this will not be our last time, Tasha.
I look forward to our next discussion.
Every time.